This week, we are going to talk about body sculpting, which we have touched on before. We've talked about our Coolsculpting machine. So we wanted to talk about body sculpting in general. And we're going to switch it up this week. And I'm going to be the patient, and Dr. Thomas is going to consult me on what he thinks I need.
Okay, what are you bothered by,
Yes,
Rachel?
so I'm coming in. I've had 3 children, getting down to my pre-pregnancy weight, but I just feel like I'm not quite as tight as I once was in terms of my stomach.
Okay.
And so I have a little bulge when I wear my high-waisted pants. I'm a little nervous about 2 pieces over the summertime.
Are you going on vacation anytime soon?
I might be going on spring break, maybe.
Which is very common. Everyone's coming in because there might be a trip or an event, something coming up. So yeah, you're not alone. Yeah, and have you done Coolsculpting before?
Yes,
okay.
I have done Coolsculpting.
Did you have good results?
I had great results. So I had Coolsculpting done after my first child on my stomach and on my inner thighs. I haven't done it since.
God, where do you work?
I know, right? What kind of boss do I
have? Well, you can get Coolsculpting.
That's why I volunteered to be the patient today.
Yeah, so if obviously after we assess you, if it looks like you could benefit from another applicator or treatment of Coolsculpting, then we would definitely start there to see if we can minimize that pouch or bulge or whatever you're depicting or illustrating. And then probably if you haven't done it, I think like we should get you into Emsculpt, you know? And so Emsculpt is our non-invasive treatment that assesses patients from a fat loss standpoint, but also from a muscle enhancing standpoint and some skin tightening. So it kind of does all 3. Not everyone's a candidate on the front end, you know, so we kind of like to use the term debulk or contour a little bit more with Coolsculpting first and then get into Emsculpt to really define it.
Yeah.
So we say usually if you're 10 to 15 pounds from your ideal weight, that Emsculpt would be better for you. And so that's a once a week treatment for 4 weeks. You start to see results probably at like 6 to 8 weeks after treatments. And then if you're already working out and exercising, you can continue to do just your normal exercises. Or we have some patients who are like, you know what, I don't want to do my abs ever again. So I will just come in once every 4 to 6 months and do a maintenance treatment. So we have those options.
Yeah, and I think in general it's nice, right, with the Coolsculpting because if you can squeeze it, we can freeze it. So if you have that kind of squeezable, pinchable fat on the outside of your abdomen, the abdomen is the most common area that people are complaining of.
80% of patients are typically getting their stomach or abdomen done.
So if you have that fat that you can squeeze on the outside, we'll treat it first with Coolsculpting, right, to kind of debulk the fat. But then if you go into Emsculpt, just like you said, it helps really define it because it does help minimally with the fat, but it also helps build up that muscle and then also helps with skin tightening as well
because it's got the radio frequency involved with it. Yeah, and Emsculpt's nice too because so it's obviously it's abdomen is often used, but you can also do it on your buttocks. You can kind of get that lift,
get a lifted tushy,
without having to do 30,000 squats every week because that's essentially what this device is doing. It also has applicators for your biceps and triceps, and it also has applicators for your calves. So things that a lot of people don't know, but like if that's something that is an area on your body that you cannot tone because no matter what you do at the gym, then there is an option.
Yeah, and like every body is beautiful the way it is, but we are addressing concerns of people. People are coming in, and something that we think may not concern them is their concern, right? Like their calves. You would be surprised how many people are like, I've been working on my calves and I don't have large calves. We see that in men. Men come in with the Emsculpt for their calves. So we're just addressing your concerns. We want you to feel more comfortable in your clothes or in a 2-piece or in those high-waisted jeans. And then in regards also to moms, want to touch on diastasis recti.
Yeah, so Emsculpt is FDA approved for diastasis recti, which is oftentimes happens after pregnancy where you stretch those fibers, those rectus abdominal fibers, and it never comes back. So it almost looks like you have like a little bulge in your stomach.
Yeah, and
like
women
a hernia, but
women
it's not
will say to me like, it looks like there's an alien coming out of my stomach when I try to do a sit-up. Then it's just a bulge that goes all the way down the middle.
And so the surgical procedure for this is quite intensive, and the restrictions afterwards are it's almost like 3 to 4 months of no lifting. So a lot of times it's moms who still have young ones at home, and it's like, how can you
you can't take that time off. You have to lift your kids up. Yeah.
So so you can come in once a week for 4 weeks, and it will dramatically reduce. And that's because that's what that machine is doing. It's volumetrically increasing those muscle fibers, voluntary and involuntary muscle contractions without actually having to do the work, right? So and also some patients will ask like, am I sore afterwards? And actually you're not sore at all, like, which is pretty remarkable because you're getting results that would probably take, I would say, years and dedication of diet restriction and gym and working out to, to do non-invasive. So it's where technology has come.
It's a cool procedure to watch. It's a cool procedure to have done. You can just see people laying there and their muscles are contracting, contracting and relaxing.
And so we see a lot of times our Emsculpt patients are usually ones that were Coolsculpting before and then they jump into Emsculpt afterwards. Or if you're just like, you know what, I just want to feel better. If we have spring and summer and weddings and everything coming up, and if there's if it's diet, we say diet and exercise resistant fat on your body that whatever you're doing isn't working and you're bothered by it. I mean, we have the option, and that's what Coolsculpting is.
Yeah, and if you're not a candidate for it, we have other options for you as well. So to come on in for a consultation, we can talk to you about it. March Madness is a lot of fun because we have Pop a Shot up, so you can shoot some hoops.
Yeah, so just consultations. I mean, I think we would say like prizes. The icebreaker is just coming in for a consult because everyone's nervous. We understand that you don't know what cost is going to be. That's kind of a what do you call it? Like the barrier to trying to do it. But when we do these events, it's a really good time to like you're gonna get great pricing. You're gonna get financing options, interest free for 12 months. You get a little bit of extra perks or goodies with it. And so and honestly, we're gonna be, if you're not a candidate or you're not yet a candidate, we're gonna be able to tell you that. We're gonna be straightforward and honest with you. We want you to know that in Illinois, we're the #1 provider for Coolsculpting. So we do know what we're doing here. We have a lot of our staff who have been to Coolsculpting University, advanced master's university. So we're using a lot more like techniques that other clinics might not be using to get better results, which just enhances the whole outcome.
Yeah, and we've had Coolsculpting for a long time.
Yeah.
And we've upgraded our machines because we've had it for such a long time. We always, stick with the latest and greatest in terms of the Coolsculpting because we do want to stay on that cutting edge.
Yeah. So we have options. We are looking forward to March Madness and looking forward to seeing you guys.
I'm looking forward to my treatment.
Yes.
That he's promised me in this.
We actually will do a video. We're going to start with Rachel getting her Emsculpt done because
there we go. Thanks, guys.
So she used this platform to basically get her.
Exactly, to get free stuff. All right, thanks, guys. We'll see you next time.